So what are some of the key take-home messages that you hope veterinarians will remember from this work?
I think the big thing to send home is that we didn't see a statistical difference in injury rates unless every individual in the practice, so that goes from, the people working at the front desk all the way back, had training. And we had a couple different reasons that we thought that might be the case. As Jean mentioned, the cultural shift. So people are sort of there's going to be a little peer pressure to follow your training if everybody's been through the same training, or you see your colleague struggling with a patient, maybe getting a little frustrated, or the patient's looking a little stressed or starting to show some signs of aggression. And maybe you step in and say, hey, I got an idea. Let's try doing something different so that we can still accomplish what we need to with that animal without escalating their aggressive behavior. So maybe it's a culture shift thing. The other component that we theorized is that, if the whole team isn't on the same page with reducing stress in our patients, maybe the veterinarian has done fear-free or low stress or cat-friendly training, and maybe some of the more experienced technicians have too. But if your new hire vet assistant who doesn't have a lot of training on reading body language and is maybe a little nervous is the first person to go get that pet out of their carrier, maybe they're a little nervous and they don't know what to do, so they pick the cat up by the scruff. That patient already is escalated before it even meets the more experienced members of the team. And so the early experience that animal has, even when their owner gets them in the car to come to the vet, maybe they need some pre-visit meds, or maybe they need a different type of carrier, or maybe they need nausea meds for the car ride. And all of that goes into reducing stress in the patient so that hopefully they're less likely to injure somebody and have a bad experience themselves throughout their vet visit.